we know that there's something really exciting coming up with Lifetime. Can you walk us through what it is and how you kind of got involved with it?
Yeah, so Lifetime has a show called Access Health, and it's a show that kind of highlights a variety of different medical issues and treatments. And it tends to be a bit geared towards women. And so they did some research and found out about the Lucy trial, which our site was a part of, and which I was fortunate enough to be the national chairperson of. And so they decided they wanted to do a piece on aneurysms, and specifically aneurysms in women and the trial, because it's the first trial of its kind in the world that sort of matches men versus women and how they do in aneurysm repair.
And being that you are now involved with that, and you have already, I think you've already recorded for it and everything like that, what's it like just being able to use your expertise and be able to be a part of Lifetime's documentary here?
So, I mean, certainly, you know, being invited by Lifetime was an honor, and it was a lot of fun. You know, it was a learning experience. But I think more importantly, it sort of highlighted the importance of the trial. The trial, when it started years ago, when we first came up with the concept, we struggled to get people to buy into the trial because they felt that maybe it was an unnecessary trial. And that studying aneurysm disease and treatment in women really didn't have a particular place in terms of aneurysms and their outcomes. And so given the fact that it took quite a lot of traction to get the trial off the ground, seeing it sort of come full circle and now be picked up by not only Lifetime, but we've presented the results nationally. We've presented the results in the European Union, United Kingdom, and most recently in December I was in Australia for a meeting discussing the results. So I think it just goes to show that what people didn't really put a lot of weight on, now that they're seeing the results, they can understand how important it is to look at diseases in women differently than we look at them in men.
So what do you think about just having the general public being able to get more involved in understanding what this means and knowing that there is a difference between women and men when it comes to this?
Yeah, I think probably one of the most important things is women are often not thought of as being at risk. And so that's one big misconception. So a lot of times we find these things being screened for and diagnosed in men. But women are not diagnosed, and they certainly aren't diagnosed early. And so the first thing I would hope is that we see an uptick in the diagnosis of the problem in women. I think the second hurdle to overcome is historically women have always done far worse than men in terms of their outcomes when treating this problem. So a lot of times when women are diagnosed, they're not offered treatment because they're just felt to be too high risk. And so what this study shows is that women can be treated equally as safely as their male counterparts in minimally invasive fashions with no bad outcomes really when it comes down to it. So I think first is diagnosing it, and then second is trying to get both the public and then also referring providers to understand that it's safe and easy to treat women with this disease in 2019 with the technology that we have.
Is there anything that women can do? I mean, now that we're getting the word out, we're having this discussion, is there anything they can do to be proactive in this situation?
Yeah, sure, absolutely. So I think number one, women and men both, you sort of have to take charge of your own health care. And so certainly there are some guidelines for screening specific to women if they're over 75, if they've smoked in their lifetimes, and certainly if they have a history of aneurysms. They should push very hard to get screened because the screening is just a simple abdominal sonogram. It's not a difficult test to do. It's not risky. And so certainly taking charge of your health is a big component to this. And so if somebody's not listening to you, maybe bring it up to another physician or seek out a screening program. And then secondly, don't take no for an answer. If you are diagnosed with a problem, just because someone says that you're high risk, you may want to reach out and get another opinion because things are always changing. Technology is always evolving. And so if nothing else, I would say, take charge of your health and prevention. And that's probably one of the most important things we can all do.
Is there anything that you would like to say to people who are considering watching this, or if you want to have just any words on why they should watch it?
I think it's an interesting special because not only do we dive a lot deeper into the trial and the treatment and the great outcomes that we had in the trial, but they also have featured a woman who received the implant, who received the graft, and essentially says that she got a second lease on life. So you sort of get to see a human side to that story of someone who was diagnosed, who thought they had no options, and who ended up progressing to treatment, and she's doing great. So I think just seeing that, it sort of offers some hope and comfort to people, because certainly when you're diagnosed with an aneurysm, a lot of people look at that as a death sentence, and it's not. It really is not.
Anything that I didn't think of that you think is important to add for the people that are watching or anybody that's just listening at this point?
Yeah, I think the most important thing, particularly when it comes, to my specialty, which is vascular disease, the most important thing to remember is that in this day and age, regardless of the diagnosis, regardless of the blood vessel bed, early detection is key. Managing your risk factors is key. Staying in touch with your physician and making sure that you're managing your health is key. And then understanding that in this day and age, regardless of your diagnosis, the treatment options that we have now to treat these problems have come so far. Even in the short time, the 10 years I've been in practice, what I do now is so vastly different than what I do when I started 10 years ago. And so what I would say is when you're diagnosed with these problems, don't lose hope, because there's always an answer.